What's your name?
Mandy, teacher,
And do you know what today is, Mandy?
March 2nd,
Okay, and you know where we are?
in Weston, West Virginia,
And do you know why you're here today?
to get it checked out.
Okay, I'm going to be doing an examination of you today. You don't have to take your clothes off or anything. We're just going to do a head-to-toe examination. I'm going to check your skin, I'm going to check your lungs, I'm going to check some reflexes. So I'm going to come around behind you. I'm going to start with your head.
Okay.
So I'm looking at the scalp and at the hair. I'm looking for the quality of the hair, checking hygiene. I'm going to check for lice. So down here around hot spots is where we usually find nits, behind ears. And I'm looking for dandruff, alopecia, any clumping of like hair loss and clumps or in patterns. And I don't see any of that. So we're going to come around here to the front. I'm going to palpate your temporal arteries. So take your glasses off for a minute.
Okay.
Temporal artery pulse is equal and +2. I'm going to move on to your jaw now. I'm palpating the temporomandibular joint. This is cranial nerve 5, so can you just open your mouth and close it for me? Once more. Okay, I don't feel any clicking or popping. Cranial nerve is intact. And so I'm going to move on to the eyes. So if you could follow my finger, we're going to test your eye movement, okay? Try not to move your head. So we're able to move laterally, up and down. Then we're going to go out to the corners. Okay. This one. Very good. So that is cranial nerves 3, 4, and 6. And we're going to check your ears. I'm looking at the gross anatomy of the outside of the ear. Sometimes we can find little deposits up here in the helix. If the patient has a history of gout, looking for any abnormal physiology of the outer ear. Ears look good, they're symmetrical, they're set in the right place on the face, in the expected place on the face. Now, I'm going to have you take your hand and occlude that ear just by, and then I'm going to come over here and say, today is Sunday. Can you hear on that side?
Mm-hmm.
Okay.
Sunday.
Switch that.
Okay.
Tomorrow is Monday.
Tomorrow is Monday.
Okay, very good. So hearing is intact in both ears. Did it sound the same in both ears? About the same level. Okay, now I'm going to check your nose. Okay, can you close one and breathe in and out? Now try the other side. In and out. Be able to move air through both sides?
Yeah.
Okay, you tilt your head back for me. I'm just checking for any polyps, checking the patency of the nares, looking for drainage, and everything looks normal there. Okay, so I'm going to move on to your neck. I'm going to be palpating your lymph nodes, so I'm going to start up here and I'm going to come down, okay?
Okay.
So I'm looking for any firm, swollen, tender lymph nodes. The back of the neck. Okay. I'm going to touch your throat. I'm checking for alignment of the trachea. It's midline. You swallow for me. Okay. I'll put your chin up just a little bit, and I'm going to palpate for any enlarged thyroid or thyroid nodules. And I'm looking here for a scar from a thyroidectomy. I don't see that. So I'm going to test the strength and the range of motion in your neck now, and I know it might be a little bit limited, so don't push it past where it's comfortable for you.
Okay.
But I have you move your chin all the way to this side. All right, back to the center, all the way to this side, back to the center. Can you touch your chin to your chest? Okay. Now I'm going to have you just try to turn your head against my hand. Okay. Now the other way. Okay. We're going to move on to the chest. So I'm going to inspect and palpate the chest. I'm not going to have her take her shirt off, but I'm just going to move down the ribs. I'm checking for any tenderness. Are the ribs intact? Can you lift your arms just a little? Take a deep breath. Okay, let it out. I'm gonna come right underneath this breast and I'm just gonna palpate for an apical pulse. Okay, and I'm gonna come around here in the back. Check in for spinal alignment while I'm back here. Looking for any scars, any evidence of surgery or trauma. You take a deep breath against my hands again. Okay, any pain in your ribs when you do that?
Mm-mm.
Okay, you can relax. I'm gonna wait until the end to do everything that we need to do laying down. So your abdomen, and then I'm gonna look at some things to do with your heart when you're lying down. We're gonna go ahead and we're going to move on to your extremities. So can I see your hands? So here we're checking for extremity temperature. Fingers are a little bit cold, but the color is good and the patient says that's normal. Checking cap refill, I'm gonna blanch both sides, release, little delayed. Her fingers are cold, checking pulses. Might be a little dehydrated. Checking skin turgor. Pulses were maybe close to a +2, maybe a +1. They were a little thready. They were equal. Checking skin turgor. Looks good. I like to check skin turgor here too, especially if you have an elderly person. This skin tends to be thin and loose and it tense really easily. So I also like to check on the chest. We're not going to put her through that because she has good skin turgor on her chest and I have to pinch her. Okay, we're going to move on to skin turgor. We're going to check the hair distribution when we're doing this. So we're going to move on to the lower extremities here. I'm going to pull up. Of course, it's normal to find that people have shaved their legs. Do you experience normal hair growth on your lower legs?
Yes.
You do shave your legs. So sometimes if we have a lack of hair growth on the lower extremities, sometimes that can be genetic, ethnic, and sometimes it can be a sign of arterial insufficiency. So palpating pedal pulses. They are palpable and equal. Again, I would say probably a +1. Let me check for dependent edema, some trace edema, non-pitting. And it's about the same on both sides. Okay, we're going to move on to your range of motion and your muscle strength. So we're going to systematically go down and we're going to test your range of motion in each of your major joints, okay?
Okay.
So we start by lifting your arms. Oh, look how good you've done.
I know.
She couldn't lift her arms that high
I know.
a year ago. Okay, I'm going to bring them out in front of you and back. Can you bend your biceps? Okay. I'm going to have you push against my hands.
No, this is where it's
Okay.
a little weak. But
Actually, I didn't detect any difference side to side, maybe just a little. Okay, and you can put your hands down in front of you. Can you raise them out like this? Okay, I'm gonna have you stand up for me. Can you pick this knee up? All right, back down, pick this knee up. All right, have a seat. I'm gonna have you push and pull against my hands. Push. Okay, that's good. Now try to push up against my hands. Okay, she's got good strength. I'm gonna put this knee out. Try to bend your knee against. Okay. Out this one. Try to bend. Okay. All right. I'm gonna have you shrug your shoulders. Again, there you go. Okay. Can you twist? And then the other way. All right. Can you stand up for me? I'm gonna have you touch your toes. Very good. All right, have a seat. Now, one at a time, I'm gonna have you point your toes.
oh, one at a time.
Now show me the other one. Okay. Now flex them. Very good. Now, can you roll your ankle? All right. And then last one, you stand up for me. Can you bring your foot away from your body like this? Come back to the center, and then, okay. Very good. All right, you can have a seat. We're going to do the neurological test before we lay down and do your abdomen But first, let me make sure we've tested everything we need to. We've done your spine, your shoulders. Can you do your wrists? Any pain, clicking, anything like that?
A little clicking.
Little clicking, is that normal? Do you have arthritis or?
I have Ehlers-Danlos.
You have Ehlers-Danlos. So you have some hyperflexibility in your, particularly in your wrist joints, or?
Mostly in my hips, but knees and wrists, elbows.
Oh,
Yeah.
yeah. Okay.
And I had that broken collarbone and a rib missing too. I don't know if that matters.
So yeah, you can, I don't know if we can, I want to take your shirt off, but you can see the indentation here and the scar where that was removed. There's sort of a concavity in the thorax there. Okay, I'm going to listen to your lungs. So deep breath through your mouth. Let it out. No inspiratory or expiratory wheezes. Deep breath through your mouth. No crackles to indicate atelectasis. Listening in between the intercostal spaces to get the best resonance. We can go all the way up. This is our lung bases back here. Okay. Now I'm going to come underneath of this arm and do the same thing. Listening to vesicular fields. Often hear wheezing here if the patient has asthma or if they're a smoker. Good air movement, no adventitious sounds. So we're going to listen to the anterior fields. Deep breath. Let it out. Deep breath. Let it out. This is where we'll often hear bronchial sounds. The patient has congestion, bronchitis, inflammation in that ventilation space. Okay. And we're going to listen to your heart valves. So this might be a little, I might actually have kind of a window here because you have this missing rib. So the second intercostal space on the sternal border is where we're going to listen to the aortic valve, but we have like a whole entryway here. Okay. S1, S2, no S3 or S4, no murmur. Come to the other second intercostal space. S1, S2, no adventitious sounds, no murmur. I'm going to come down to the fourth intercostal space. Everything sounds good. And then we're going to come down here to the apex and listen to the mitral valve. No murmur. Okay. So we're going to palpate the carotid arteries. So we're going to avoid the carotid sinus. We don't want to make her faint. So, oh, I did, that was bad. One side, other side, +2, on both sides. Palpating only one side at a time. That was so much stuff. Okay, I'm going to auscultate for any evidence of stenosis. Okay. All right, we're going to move on to the neurological examination. So I'm going to put you through a couple of different tests to see what you can sense and what you can't sense. We're going to start just with normal sensation.
Okay.
So I'm going to use my pen and I'm going to touch your face. That side? That side? About the same?
Mm-hmm.
Okay. Feeling both?
Mm-hmm.
About the same?
Yep. This one tickled more. Bit of focus. About the
It
same.
might be that rubber band on your wrist.
Oh, maybe.
turn your palms up. How about that?
Mhm.
That?
Yep.
Okay. Here and here.
Mhm.
Same. Here and here.
Mhm.
Okay. So we're gonna do the finger to the nose test, okay? So I'm gonna hold my finger out and you're gonna touch my finger, touch your nose, okay? Touch my finger, touch your nose, 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 touch my finger, touch your nose. One more. Okay? So that was no positive findings there. Now we're gonna do I'm just gonna stand up and just walk a couple steps. I'm just watching your gait.
Okay.
Okay, and then when you turn around here to face me, I'm gonna have you put your arms straight out in front of you and close your eyes. Looking for any drift in the extremities, we need to wait 5 or 10 seconds. Looks good. Okay, can you heel toe back to
Like one in front of the other?
Mm-hmm. Yep, just like you're walking a tightrope. Back to your chair. Very good. Okay, have a seat. I'm going to have you close your eyes. And let me see this arm. I'm going to pretend to write a letter on your arm. You tell me what it is.
Oh.
Okay, now over here, I'm going to do...
A.
Okay, very good. Now I'm going to have you keep your eyes closed.
Okay.
I'm going to touch you with a cotton swab. You tell me right, left, upper, lower extremity.
Left forearm. Right thigh. I think that was the right forearm. Right thigh. Left calf. Left forearm. Felt like it was kind of on my right shoulder area.
That is all right, now keeping your eyes closed, I have a series of objects that the patient has not seen. First, I'm going to test your sense of smell or your olfactory nerve. I'm going to just wave an essential oil under your nose. You tell me what it smells like to you.
Do it one more time. Lemony? Orangey?
It's orange. Now, keeping your eyes closed, I'm going to hand you a series of objects that you haven't seen, and you tell me what those objects are, okay?
Okay. Toothpick?
Mm-hmm. See your other hand?
Earring.
Very good.
Comb.
Okay, you can open your eyes. All right, for the last part here, I'm going to check your abdomen. I'm going to check we're going to do your reflexes first. So let your legs hang, okay? I'm just going to, I'm not very good at this, but somewhere in here. Sorry.
You're good.
Could use some mastery on this. Good. There.
Oh, I felt the kick, yeah.
So we got a positive reflex there. I think I'm going, there we go. Okay, reflex is intact. All right, I'm gonna have you lie down here on our little pretend table.
Okay.
Just lie flat on your back. Now I'm gonna take a pillow and I'm gonna raise you up to 45 degrees, okay? Right about there. I'm gonna have you turn your head to that side. And I'm looking for jugular vein distension. Okay, now this side. All right, very good. We'd be inspecting the abdomen for any blood collection back here that might indicate internal bleeding, any bruising around the umbilicus, any hernias, discoloration, looking for an aortic pulse that I may be able to palpate, but it should just be able to palpate it lately. Okay, now I'm going to palpate all 4 quadrants. Tell me if you have any pain or tenderness. Okay. All good? Yep. All right, and I'm going to come down here to your feet. Test plantar reflex. So no Babinski reflex. We're good there. Okay, I think we're done. You can sit back up.
I'm healthy.
Yeah. Good.